That's the aspect. You know what I mean? So the system, they have a revenue tax. It's so ridiculous.
Thank you, sir.
Okay? Thank
Okay,
you.
that's the God bless you.
Feel for you. Feel for everybody that's
Yeah.
having to go through this.
We're
in
going
the
to take
middle of a pandemic.
yeah,
and
in the middle of a
surge.
pandemic, and let's go pandemic right now. Lillian Posadas, the Guam Memorial Hospital administrator, joins us in the KUAM News Zoom room. Good morning, Lillian.
Hi, Lillian.
Good morning. Good morning, everybody. Good morning, Guam.
Good morning.
What's cracking over there at GMH? Not looking
Our
good.
our census is at 21 COVID individuals. Of the 21, 2 of them are in the ICU level of care. They're not on ventilator support, but they are on high flow oxygen. 13 of the 21 are at the telemetry level of care. 5 are at medical services, general medical services. They're pretty stable. And then 1 in the MCH area, a female individual. So that's 21. And, our total census in the hospital is 162. So again, we're at high numbers, both COVID and non-COVID. Of the 21, 15 of those individuals are unvaccinated.
So that would mean it's 21 minus 15.
71% are unvaccinated.
Right, yeah.
And then 6 are vaccinated.
Vaccinated.
They've
Yes.
also got some. I know hospitalizations over at GRMC, Lillian. So it's a little different when we get
Yep.
when we got you on last year. GMH was the designated dirty hospital, and so the numbers that you were reporting then were very accurate. But now with GRMC also having COVID patients,
Accepting.
it's almost like
they're accommodating COVID patients also, and theirs is in the 20s as well.
right.
Yes. So, yes.
You mentioned
we'll expect-
a patient in the MCH ward. Are we talking about a pregnant lady?
Yes, a female individual. Yes. Mm-hmm.
What about pediatric hospitalizations?
Knock on wood, unfortunately, none needing to be hospitalized, but we have seen a couple in the emergency room, brought in the emergency room with symptoms of fever. And so they've been treated, they've been evaluated, they're stable, their oxygen levels are okay. And so they're released home to isolation in the home setting.
So currently no
No
children are...
pediatrics in the house.
Any teenagers?
No, not even teenagers. I think the youngest is in the 20s.
The female individual in the NCH unit, you said she was pregnant. Is she vaccinated, unvaccinated?
No, not vaccinated.
Right. How were the Lillian? Because when you look at like the total numbers, right, just from what we reported last night, it was like 26 unvaccinated, 17 vaccinated. So I know at GMH the unvaxxed are 3-1 with the vaccinated, right? But when you add in GRMC, it kind of seems like 26, 17. It looks like the vaccinated as well are being hospitalized. But what can you tell us about their condition when they are hospitalized?
It varies on the individual. For the most part, the ones that have been vaccinated, their hospitalization is not that long, not prolonged. But they do have the fever. They do have some respiratory conditions, respiratory symptoms, and they're put on small oxygen flow rate, and they get pretty stabilized, and so their hospitalization is not as prolonged as those who are unvaccinated.
Out of the individuals that are in ICU, are any of them vaccinated?
Let me take a look at the report and see if those individuals who are in the ICU level. Oh my gosh, I don't have that with me on this report. Hang on a minute. Okay, give me a second. Let me take a look at where they're at. Okay, there it is. Which one? The two of them, one is vaccinated, the other one is not vaccinated, of the two in the ICU.
What can you tell us about any additional information about the two COVID-related fatalities that were reported last night?
The two that were reported last night,
So
were those the ones that was from last year?
There were two from last year that they're reclassified,
Right.
and then there were an additional two.
That passed
Okay.
away on the 28th.
Okay. I need to go back in my notes. There's just been so much data going across, I can't even remember anymore. But the two last year, one in October 2020, one in December, I haven't had a chance to go backtrack on those two cases. And I don't know if it may have been they just needed to verify or to confirm the diagnosis that the doctors put on the death certificate worksheet. I don't know if that may have been the case. I'll need to go back into 2020 log and get back to you. I just did not have time to go back into it before our call. But as far as these recent ones, the last two, I'm sorry, I'm blanking out. Like, okay, which ones were those? And I know we report that. It's just that there's been quite a bit of information or activities going on. So give me a few minutes or give me time and I'll text it to you or I'll report it to you another time.
Really?
I just don't have the information.
Right.
And I don't want to guess.
Of
and
course.
I don't want to,
Totally, yeah. But Lillian, like, what's the feeling over there at GMH with the staff? Because we're feeling out here in the community, like everyone I talk to, we feel like we're back to square one.
Well, it feels like it, yeah, absolutely. Because, the numbers, again, we're going back to opening up our care units. We're seeing these individuals who come into the emergency room with the fever, with the symptoms. But, what's also just concerning is that, people who choose not to get vaccinated for whatever reason, I mean, okay, their freedom, their rights, they're not trusting the vaccination because it's an experimental drug. They're not trusting the medical system, but yet, when they get sick, where do they go? To the hospital, and we take care of them. So, and it's just we need to take care of them, but at the same time, we need to try and really educate them that the vaccine is safe. I got vaccinated, and a lot of people got vaccinated, and it's working. It's effective. It's our tool to fight this COVID. And so if we just, if everybody would get that vaccination, it can really reduce all these events. Plus, it can reduce the those who are unvaccinated, particularly the children. We can prevent them from getting the COVID because it's everywhere now. This COVID is everywhere.
Right. It's everywhere, and even vaccinated individuals are getting COVID-19. Lillian, where are you with the SNF? Is it full already?
It's at 23 right now this morning. The census is at 23. The doctors are continuously working with the staff, the nurses, to see which patients from this site who are non-COVID, who do not need to be in an acute care bed, but can go over to the SNF. And so we're gearing up to accept as many as we can, up to probably even 30 if we need to. That's the plan, is to keep opening up the beds over at SNF for non-COVID. And we cannot combine COVID and non-COVID in that facility yet because of the ventilation system. That was our plan, was to get that the ventilation separated from the wings, so they're not sharing the air. But we just between the procurement process, it's taking us a while to get that project completed. We have the design for it, but we had to go through the procurement process to get bids from contractors who would do the job for us. So that's what's delaying all this. We wanted to get that facility ready and done, but things take time.
Lillian,
Unfortunately.
we've asked you a lot, especially last year when things were this bad,
Mhm.
to give a message out to the people, the community. What's your message this
The
morning?
yeah, the message again is, if they can just, think of the greater good, think of the island's safety, health and safety, and not just for our own personal, rights and personal freedom, but think of the community and others in our community, especially the unvaccinated, the children. Let's do our part. Let's be responsible and do our part to get vaccinated. It is safe, it is effective, so we can, collectively, we can win this battle together. So please, I urge the people, I urge the community to try and get the vaccination.
Lillian, have you had any nurses resign? I mean, because it's just so much. Here we are going through this again. It's like we're back to square one. And when there was just a
Yeah.
national story about, especially the ICU critical care nurses, they just
Yeah, they're
that's a
tired.
national story. Yeah.
They're exhausted. Yeah. And they're risking their lives. They're risking their lives to continue taking care of individuals who come in with the COVID, and so they're risking their lives, their families, and so we haven't had much of any resignation recently. Since last year, we had quite a bit of resignations. Nurses with the anxieties and the fears, they didn't want to, they did not want to put themselves at risk, and so there was quite a bit of resignations, even early retirement. Nurses who were not going to retire, but with the COVID, it kind of just pushed the decision up sooner to retire. So we lost again also some of those nurses through retirement. This year, we've had some nurses resign to go off island to pursue a higher education. Some of them are dependents of military personnel, and so many different reasons. We've lost some. I can't even remember the total number of nurses who have resigned, but we've also been very fortunate to have recruited many nurses. Still, though, not enough, because we still rely on the travel nurses to help us through this battle, and so it's very fluid. It's just a revolving door, and not just nurses, but also like respiratory therapists, radiology technicians, technologists. We've lost some. So nurses and healthcare professionals, it's a continued challenge.
You mentioned the COVID care units you've opened some back up. How many do you have open?
We opened up the COVID care unit 1. That was the very first COVID care unit, which was our urgent care clinic, and that's right adjacent to the emergency room. So we've opened that up as an overflow for ER. At the same time, we're using that also to administer the Regencov monoclonal antibody infusion for those individuals who meet the criteria. So we use COVID Care 1. We've opened up COVID Care 4, which is our third floor telemetry unit. Because, a lot of these COVID cases, 13 of them need the telemetry cardiac monitoring service. And so that's COVID Care 4. We're looking to open up today COVID Care 3, which is our fourth floor pediatrics unit. Because it also has the negative air pressure capability. At the same time, it has the cardiac monitoring capability. So we're going to be opening that up as our Care 3. Care 2, which is the one adjacent across the hallway from our ICU in second floor. We've got that all prepped and ready to be used as an extension of ICU and any other, multi-level COVID patients.
Mm-hmm.
So those are the units that we've opened back up, to accommodate these COVID patients.
So the number's 21 right now. What is the max for GMH to handle the COVID patients before you start breaking up and putting up the tent?
Okay. We have requested for the Blue Met tent to be erected right outside of our ER, and that is going to give us again also some capacity for ER overflow because we've been going on. Our ER has been very saturated, both
Yeah.
COVID and non-COVID, and so not only are we using the COVID Care One as an extension, but we also need the Blue Met tent. So we're getting we submitted a request to EOC for the Blue Met tent and the GUNG. They're going to be here on Public Works to do an assessment this morning on setting that up right outside of the ER. Total number of beds, I'm going to need to crunch those numbers for you. So in the ICU, we can accommodate 14 ICU COVID patients. In the telemetry, I believe 24, 26. In the pediatrics, which is our COVID care 3, we can accommodate about up to 20 adult COVID patients in there. We also have the med surg area that we have ramped up the telemetry capability. We can, partition off one area there that we call annex. It's got 15 beds that we can cohort 15 COVID patients. So those are the numbers for now that we have, that we can stretch and use for COVID patients if we need to.
So you're looking about what 73 beds and is that
73? Did it come out to be 73?
yeah, around 73.
My calculator's not on right now, so
I'm pretty bad at math, so it could be off. But the Blue Med tents. Are you anticipating that after the assessment this morning that it could go up as soon as today?
Today, yes, we're anticipating that it will go up today because just to make sure that every time we have a saturation or emergency room, we go and divert, and we don't want to continue doing that. So we want to make sure we have an additional bed space for individuals who come into the emergency room, so we can accommodate them.
All right. Well, thank you, Lillian. I know you got a whole lot of stuff to do. Was there any final message, I guess, to the community?
Yeah, to get vaccinated. If people can get vaccinated, those over 12, if they can get vaccinated, that would be a tremendous help. Really tremendous help for us, for all of us.
Okay. Thank you so much. Also, I just want to put in a request to perhaps get Dr. Jolene again on the show.
Yeah, maybe we need another
Yeah.
talking to.
Yeah.
Yeah, I will give her. I send her a text, and then maybe she can come on for a few minutes with you all.
Yeah, next week.
Yeah.
Thanks, Lillian.
Thank you,
Oh, you're
Lillian.
welcome.
That's
Thank you too.
okay,
Take
be
care.
safe.
All right.
9:34.
Yeah, it's time to get Dr. Jolene again.
Yep, the song on you guys. Give you guys a lecture. It's 9:34. We're gonna take a quick break, and we're coming back with more of the show next. Oh, before we do though, I did get a message from Daphne.
Okay.
And Daphne where you at, Daphne?
Oh, and I just popped up MyGuamTax.com. It was very snappy.
Yeah, so Daphne said, hi, Chris. People are slowly able to file online. We have about 3,000 applications so far. It's still pretty early in the filing process. We're appreciative of everyone's patience and input. We're asking that they give it a bit of time and then try again.